Hello, and thank you for joining us for tonight's Metabolic Code clinical case review using the Metabolic Code report. We are here with Jim Laval. I'm Libby Bricker, your moderator. We will break for a question and answer session at the end of the review, so please raise your hand or enter a question in the chat box. Without any further ado, I will pass the screen to Jim to get started.
Okay. So you got my screen now?
Not quite yet.
Okay.
Let me try and pass it one more time. There we go.
All right, so I hope everyone's doing well tonight. So we're going to go through
Hello, and thank you for joining us for Hello, and thank you for joining us for tonight's Metabolic Code clinical case review using the Metabolic Code report. We are here with Jim Laval. I'm Libby Bricker, your moderator. We will break for a question and answer session at the end of the review, so please raise your hand or enter a question in the chat box. Without any further ado, I will pass the screen to Jim to get started.
Okay. So you got my screen now?
Not quite yet.
Okay.
Let me try and pass it one more time. There we go.
All right, so I hope everyone's doing well tonight. So we're going to go through a female. Birth date is 1/1/54. I think we find this case interesting. She didn't really score super high in her lab, but I think when you see how her symptoms are playing out and her labs are playing out, you'll kind of see the complete picture of her. If you look, so she has at least 1 to 2 drinks per day. She does exercise regularly. There we go. She takes hormone replacement therapy, and which she's taken a oral estradiol, if I remember right. And the next thing is that she gets tired after she eats a big meal. So right away we start to get an idea. So she's on an oral hormone. She drinks a couple books a day. She gets tired after eating a big meal. Her memory and concentration's a little off. So she's probably, getting a little dysglycemic after eating that big meal. She feels emotionally flat. Her short-term memory's off. So that's kind of showing you where her cortisol probably is. I mean, more than likely her cortisol is a little low. She has a few here. She gets a lot, more than that for calories after 5 p.m., which is usually a sign that it could be a sign either way of adrenal high or low. That's just an imbalance in the diurnal pattern of your cortisol. So right now, right away that she's, kind of feeling worn down. That translates into, say, sleep as well. She has cold hands and feet. Her eyebrows and hair are thinning. So we know that the thyroid might be involved. We'll see if where her thyroid hormone is at. I have not looked at her lab yet. I am predicting where she's at based on that. So let's see. Handshake or tremble was a yes. That could be even adrenal high. If you look, not a lot of symptoms in her gut. She gets gassy and bloating, and she's consistently taking non-steroidal anti-inflammatory drugs, which, the new warnings on that, of course, is that, the consistent use of those is associated with increased risk of heart attack, right? So that is interesting. And then if you look through, she's got some stomach acid issues, right? She feels full for a long time after eating. She didn't have stomach discomfort or pain before eating. It was more discomfort on her part. I think she's just gassy and bloated a lot. She wasn't having stabbing pain or, any in-depth pain. Of course, we know that their immune system then's a little bit weakened, and then she breathes through her mouth. So what that tell you? She's not breathing through her sinuses. If her sinuses are congested, her gut is probably, the immune function in the gut is probably triggering a lot of allergies. So you can kind of start to see these connections of she's bloated, she's gassy, her nose is congested, so she's got, chronic congestion, and probably means she's got food allergies, right? Probably got to put her on an elimination diet. She notes that she doesn't get enough sleep. Well, no wonder her memory and concentration's off. She can't fall asleep because she plays the events over from the day. She's under excessive stress. She's a restless sleeper. She only gets between 5 and 7 hours. What's poor cognitive function, right? And hormone failure and low thyroid, right? When you're not sleeping. So all these pieces are starting to kind of shift around and starting to make sense. Told by her doctor that she has bronchitis or gets bronchitis. Once again, immune activation, histamine increase. That histamina's from the gut and food reactivity, or it's coming from the stress triggering the histamine release, or both, right? So it could be she has difficulty holding her urine, tenderness of the breast, headaches related to her menstrual cycle, her sex dries down, she's got a history of uterine fibroids. We know she's estrogen dominant, doesn't have enough progesterone. She has had birth control use, so we know that she's taking, that she's had a big deficit in vitamins and probably other nutrients as well. And then she also uses bioidentical, but she wasn't, and so uses bioidentical progesterone, and then of course she's going through menopause. So let's see what her report actually shows. So she's 61 and she's got some, hormone issues. that'll need to be addressed. And, I think that there's a million ways to skin that cat, and we'll talk about that a little bit, but we'll see what she really needs to do, of course, once this opens up. And we'll see how it lays out. Oh, connection's running slow tonight. I'm going to close it and just try it again. Oh, I guess that didn't do it. Okay, it's moving a little better now. There we go. All right, let's see what it's... So, no surprise, from her questionnaire, with all of those sleep questions answered, she comes up with the highest score in adrenal thyroid pancreas, which I think you find out a lot. Now, that being said, I had 3 cases I reviewed today, and it was interesting. Things were shifting, quite a bit. Now, in this, it's quite clear she's got a lot of symptoms related to her estrogen and progesterone. So her bioidentical hormones aren't, really managed the way they need to yet. So we got to take a look at that. And then, of course, got to be in brain with the bloating, the gas, the sinus problems. All things are pulling points into there, as well as cognitive function, her sleep issues. It's just, she's just scoring points left and right in that area. And then, of course, it starts to teeter down, but that testosterone and progesterone just kind of on the borderline need to be dealt with right away, especially if she's not feeling good. If you notice her risk, her cardiometabolic risk is elevated. Obviously, cognitive and mood risk is elevated because she answered, felt flat. She didn't feel like she was short-term memory good. So there's right off the bat, that's an issue. And then if she had any of the things like low cortisol, that is going to add even more points into the cognitive risk. Her detox risk is high. She had uterine fibroids, so you're assuming that she's making bad estrone and it's not being metabolized well, so that add into there, along with other factors as well. And the other ones are immunity risk, metabolic damage, intestinal health, and immune function are intermediate. So let's take a look and see what the lab showed. And here we go. Lo and behold, her cortisol is low normal. Her DHEA is low normal, so she's going to have memory problems. She's going to feel fatigued. She's going to feel flat. She doesn't have the stamina. That's right there. And her sodium's at 136. So interesting to see. Let me see what her blood pressure was. Well, I'd have to go back. I'll do it when we're done. Be interested to see where her blood pressure was. This is where you probably want to do a day and night blood pressure. You also want to do a sitting and standing blood pressure on it because that excuse me, I'm going to get right back first. Because her cortisol is dipping low, and her sodium is low, and her DHEA is actually holding in, but still a little too low. But this is telling you that she's probably becoming hypocortisol. So orthostatic hypotension, logical questions like you get dizzy on standing kind of stuff would make sense, and then doing a sitting and blood pressure would be great. Let's find out if my thoughts on thyroid came through. So her T3 is 0.9, which isn't great. Obviously we like it at 3.5, 3.6, or ideally. But look at her total. She's hardly making enough T3. Her T4 is okay, and her total T4 is okay. So in general, she's just not making enough thyroid hormone. So this would be a case where probably sildenafil and iodine would work out, or something to stimulate making more thyroid hormone. She doesn't have antibiotics, but she's got a little bit there, but not really where it's super concerned. But you're going to put her on a limited diet anyway, get her gut straightened out, just because she's gassy and bloated. And you're going to put her on a modified low-carb diet that gets all the high reactive foods, so our metabolic code diet. Her ferritin pool is borderline high, and her glucose, look at this guy, glucose is at 98. So she's someone, and her body weight wasn't that high. I think it was only like 130. So she's not someone you'd think would necessarily be that high. She exercises regularly, but she's under stress. And so her ferritin pool was starting to trend high because of her glucose. Glucose obviously tells you that, she's probably not getting a good night's sleep. It's a morning fasting glucose. A lot of times I'm seeing people with high morning fasting glucose is just from their cortisol levels, poor sleep patterns, and then their blood sugar maps out the rest of the day. But they have to test it a couple times a day to figure that out. If their A1C is low, but her growth hormone is low, and not enough potassium, not enough magnesium. Both of those are signs that her steady state blood sugars are too high. Then, if you look here, her vitamin D needs to be improved. Her eosinophils and monocytes, and let's get her basophils, 0.7. Her gut's not super leaky. But she does have some inflammation, right? She's at 1.1, and her CRP should be under 1. And then, let's see what else is big. Look at her LDL particle number. So that blood sugar and that cortisol and that moderately low thyroid is causing really small lipid particles. So this is cranking up the cardiovascular risk quite a bit, right? And then here's her blood pressure, right? Remember I said I almost thought it would be low? It's at 110/70, which is at the very edge acceptability, right? So if you probably stood her up, I bet she wouldn't respond. She'd probably get dizzy and her blood pressure would drop. So she's right down where you really wouldn't be watching this. But even 110/70 is still good, but it's what happens. What does she do at night? Does she get dizzy on standing? And let's look at the liver. You see here quite a few. Her hematocrit, it's turning just a little high, but I wouldn't pick that too much. Her hemoglobin looks good. Red blood cell counts are just trending a little bit, but nothing really to be concerned over. So this is really fairly modest. Not a lot going on there. White blood cell count, just a little off, but honestly, that's not too bad. Creatinine, her GFR is at 85. That's still good. Her proteins are still good. Really, the kidneys come out pretty good, and that one didn't score that high. And let's look at her hormones. Well, lo and behold, there you go, right? You guys see this a million times, right? She's got fibroids. She's got a lot of estrone. Comparatively, her estrogen's 4-to-1 or 5-to-1 from her estradiol. She's obviously postmenopausal, but she's taking a hormone. I'm trying to, I think, now I remember the case clearly, she was on an oral. She was on an oral. So she's obviously metabolizing it correctly. And the progesterone, while it's bumped up, isn't nearly enough, right? So it's like a 140/5. So you're at a 30-to-1 ratio. So the progesterone should be looked at more thoroughly, maybe evaluate her different light, so that's salivary or a urinary, maybe switch her from oral, but she certainly progesterone and just needs to get that burned off. And the issue on this, which we're modifying, is that her progesterone postmenopausally 0-to-1. That's a traditional lab marker. We are putting in bioidentical hormone numbers now because of this issue. Her symptoms come out heavy on gut, right? So you got to work with the food, and her symptoms come out heavy with her brain because she's feeling flat, dysthymic, thick-headed, not motivated, right? All those things are going on, and she's having all those gut symptoms. Not a lot, and then of course her second group of symptoms, like the adrenal, thyroid, and pancreas, which makes sense. So the next piece to this is obviously one of the things that are showing us that first triad lab value is an issue. I mean, her vitamin D is up, that relates to pancreas, potassium's down, that's blood sugar, sodium's down, it's adrenals. You can see all the different numbers that would circulate around on this now, and kind of add points into the first triad. Same thing on second triad, and we've got a bunch of new markers we're bringing in for this to really start to get the gut characterized more thoroughly from conventional labs. So we're building in VEGF, we're building in myeloperoxidase, we're building in TGF-beta as markers for inflammation and gut permeability disturbances. The other value that they bring, right? So, vascular growth factor for blood vessels and all those kind of things. And these are pretty self-explanatory. The LDLP number was pretty darn high. The T3 is low, free T3 is low, so cardiopulmonary neurovascular is off. Poor signaling from the brain to the heart, and then we don't need to go through all this. So, the big thing is where would you start? And she didn't, she had no history where, she tanked her adrenals due to, post-traumatic stress disorder. You could think you may want to do a 4-point cortisol, but if you know her morning serum cortisol is low, and pretty much her night cortisol, she's perseverating at night and she doesn't get enough sleep and she wakes up, her cortisol is most likely high. So even when you get a serum cortisol and you look at her symptoms, you can kind of see that she's flattening her cortisol curve. And you kind of want to fix that, right? So you want to think about fixing her sleep is a really important thing, because if you fix the sleep, more thyroid hormone will free up. If you fix the sleep, blood sugar gets better. Obviously, there's other things to do for blood sugar, but when you read through this, what shines is the fact that she has all sleeping problems and energy problems and cognitive issues, and then all the hormone issues that come around from improper diurnal cortisol pattern and hyperarousal from sleep. And obviously, she's dealing with issues around her sex hormones and having a history of uterine fibroids and needing to address that as well while getting her estrogen under control. So let's see what the report gave us. So this is pretty right on, really. It's cleaning up the gut, and I think that's a smart call because she's bloated and gassy and feels full an extended period of time. And if you're under a lot of cortisol, you have a lot of cortisol stress, you grow more yeast bugs. So the Candida back, good call. The chasteberry helps to balance out progesterone and estrogen signaling. So that'd be your call. Like, hey, do I want to work on that yet? Am I just going to give her some, work on her hormones in a different way, burn off her estrogen, maybe characterize her hormones differently? But at the very least, you're going to burn her estrogen off, right? So you can either use the estrometab, which is a kudzu and dim combination product. Of course, the estrium is a protein powder that actually helps with metabolizing estrogen. The D3 was obvious. You add the chromium in. The reason why there's only one chromium there is that there's the wellness pack down here, that Wellness Essentials, which is a packet which is focused on balancing blood sugar from Metagenics. You can add the Ultramil in if you're trying to get her digestion to rest. You don't need to do that. I got recommended here. The Flora is a good suggestion. You know, we always argue that everybody should take a fish oil, but maybe everybody doesn't need one right away. But if you're wanting to get one, you know, here it is to improve LDL particle size to start. And then, of course, there are breathing problems and her sinus problems. The homeopathic drainage formula showed up. But really what you're doing here is you're getting magnesium. You are getting her to sleep with melatonin, and the magnesium is helping with that calming her nervous system down. You're burning off her estrogen. You're getting her blood sugar to regulate. And really, after that, I'm putting her on thing to, I'm probably going to add something for her stress response a little bit. Even though she doesn't look particularly anxious, she is, repeating her thoughts throughout the day and especially at night. So, I'd probably add some theanine to it. So I wouldn't, necessarily. So I would go with candibactin. I would use chromium. She's low in vitamin D. I'll probably just start with estrometab and use the estrium whey vanilla for her powdered replacement. I wouldn't add the Ultramil. Maybe just do one or the other. And then why the fiber? To get the estrone out. And why else the fiber? To try to get the beneficial food it needs in order to make the short-chain fatty acids from the beneficial flora. So, and also regulate hormones related to appetite. So, really, this person's probably got a 6-product program to start, and and then we're going to track and see. Are you getting her to sleep? So how do you get them to sleep? I've talked about it over and over again. Give them something during the day to reduce their stress. Follow up with melatonin or melatonin and phenibut, a combination at night. So that is really a pretty elegant, simple approach for her. We got to get her digestion right. We got to get her to sleep, and then we got to fix her. And that's kind of how really she ranked out, because really, even though Triad came up the highest, it's the stress that's triggering all the sleep numbers and making things happen. But if you don't get her to sleep, you can't correct her stress response. So dampen her stress response in the day, get her to sleep at night, get her digestion right, put her on the diet, metabolic code diet, get her on elimination diet, and that's it. I mean, it's actually kind of interesting, pretty functional when she walked in. She wasn't debilitated. I mean, next week I'll do a crazy case for you guys. One that I reviewed today that was, she has migraine headaches. She had a death in the family. Her business failed. She's got, some autoimmune characteristics going on. So next week I'll bring a tough one in. But this case I thought was actually a pretty stable case. I thought it was something that, somebody coming in that you could manage fairly easily. And, the beauty of it is that the questionnaire and the labs really pointed to what you need to do. You need to calm her down, get her to sleep, work on her blood sugar, and then get that estrogen turned around. Now, and that'll do a lot, because the sinuses will clear up most likely when she eats well. You're cleaning up her gut, and you're good to go. And that's a good start. So I'm going to go ahead and open it up for questions. I mean, obviously there's 20 ways you could dissect this case. Just kind of try to look for the highest area of problems for her. Like, you could argue that maybe she needs more progesterone, and that would help her with her sleep. But she's a perseverator, so it's probably more than progesterone. She's feeling flat and all that kind of stuff.
Thanks, Jim. I'm keeping an eye out for questions. While we give a little bit of time for those to come through, I just want to let everyone know that I will, at the end of this, slowly scroll through the lab results. I think we had a little bit of a delay on those, and if anything was missed, it might just
Is it still delaying?
I mean, for me, it looked like, a couple seconds, but someone else said maybe longer. So that's why I'll just, at the end, I'll just scroll through slowly so we get a good view of all those labs. The first question is, how do you work up a patient for low stomach acid besides questionnaire? Betaine hydrochloride.
Yeah, you could do a betaine hydrochloride challenge, or you could do a Heidelberg capsule, right? And people that use the Heidelberg, emitting capsule, and then they track it. Different clinics that use that just to look at low or high or alternating, right? Because the sphincter's, opening spasmodically, you get an alternating hydrochloric acid level. I got to be honest. I haven't used a ton of betaine hydrochloride on people. I know it's really popular, but I find a lot of people dissect this kit. Metabolic code diet, but she's a perseverator. So
said maybe longer.
20 ways you can dissect this case.
Those to come through. I just want to let everyone know that I will, at the end of this, slowly scroll through the lab results. I think we had a little bit of a delay on those, and if anything was missed, it might just
Is it still delaying?
I mean, for me, it looked like, a couple seconds, but someone else said maybe longer. So that's why I'll just, at the end, I'll just scroll through slowly so we get a good view of all those labs. The first question is, how do you work up a patient for low stomach acid besides questionnaire? Betaine hydrochloride.
Yeah, you could do a betaine hydrochloride challenge, or you could do a Heidelberg capsule, right? And people that use the Heidelberg, emitting capsule, and then they track it. Different clinics that use that just to look at low or high or alternating, right? Because the sphincter's, opening spasmodically, you get an alternating hydrochloric acid level. I got to be honest. I haven't used a ton of betaine hydrochloride on people. I know it's really popular, but I find a lot of people end up overdoing it, burning their mucosal barrier a little bit, damaging it. So I'm very conservative with hydrochloric acid. Now, if they obviously are full after eating a high protein meal or eating a lot of protein, that's fine. So, but I've had to struggle with this because I had one group, and some people that they were teaching, some people were taking 8 hydrochloric acid capsules a day. And then when I talked to the liability side of the company, like how many people were complaining of GI distress and pain, it was like they were having all these complaints. So just be careful with too much betaine hydrochloride. So questionnaire, Heidelberg test, obviously if they're asthmatic, there's some correlation to low HCl and being asthmatic. So, that kind of thing where they're making a ton of histamine, maybe because they're low in stomach acid. So that might give you more insight.
Another question, wasn't her progesterone high? I've switched the screen over to my computer so you can get
That's what I said we're now building we have a bioidentical hormone with replacement. That's a postmenopausal woman without hormone replacement number. And so she's replaced, and that number's high. We've just put in a whole new set of rules for that. So that will be coming out not high. Because she's replaced, she'll be more than if one. But it was because we had to build, replaced, not replaced, and I've got a note to go over that tonight.
All right, that looks like it may wrap it up for questions. Like I said, I will scroll through these again slowly at the end. You don't have to wait, of course. I will post the recording to the Metabolic Code blog so you can refer to those later, metaboliccode.com/blog. Another question, do you use low protein level as a marker for possible hypochlorhydria?
Well, the problem with that, yeah, it's possible. I mean, typically I'm seeing proteins at like 6, 7, and a lot of times it's because of, it could be just poor malabsorption too. So a lot of times when I'm cleaning up people's guts, I don't use a ton of enzyme. I mean, my dietitians will add them on when they think they need to, but I get people chewing their food thoroughly and getting out of allergenic foods. And when they chew their food thoroughly and they get out of allergenic foods, they tend to digest and their proteins come up. But if you want to kind of put a Band-Aid on it, like to kind of get them started, I used to use a lot of digestive enzymes on everybody so that I could help them to digest their protein. But I got to be honest, guys, I just don't do that and haven't seen I've needed to do it a lot except in the every once in a while case. Do I have 18 hydrochloride and enzymes sitting in my office all the time? Do I use gluten digestive enzymes? Yes, they're there. But honestly, I try to prepare the process of chewing, eating, and repairing the mucosal barrier, cleaning up the gut flora, and I tend to get good results. If somebody are bloating really bad, like in her case, she's a candidate for a digestive enzyme if you give it to her, right? Because she's complaining of bloating and feeling full.
Thank you, Jim, and thank you everyone again for being here tonight and for your questions. We appreciate it. I will get this recorded archive posted to the blog as soon as possible, and we hope to see you at the next case next Tuesday evening. Thank you.
Thank you. Bye-bye.
Bye-bye.